invitation. Yes, like John said, I'm from Ghana. Ghana is one of the countries considered as one of the high-burden malaria countries in the world. As a country of 30 million people, we are recording over 5 million malaria confirmed cases in a year. That's 1 in 6. So indeed, malaria is a challenge to us, it's a problem. So we are very happy to see all these new tools coming up. Vaccines, medicines, vector control tools. But as a program, there comes the issue of how do we do it? How do we combine it to make sure that within the limited resources that we have, people who need their interventions get them, and we are saving on costs, we are saving on the time of the health worker, and hopefully we'll be able to achieve the dream of Fatimata. As a program, integration of these tools are very important, not just for the national program in terms of making sure that the limited resources go around the prioritized tools that we have. And that's why as a country, even though we are part of the high burden countries, we have set up a strategic plan that's looking at subnational elimination. And in that, we are looking at how do the implementers not get overwhelmed. The health worker wouldn't have to go to the house so many times to deliver one intervention after the other. The mother of the child doesn't have to go to the health facility several times for one tool or the other. And how do we make sure that the child is not being injected here, having a pill down the leg, also at different times? So we have integrated the malaria vaccine, the new one. Ghana was one of the first countries into our routine surveillance. And I think our colleague from Path mentioned how effective the routine immunization system is. And as part of our efforts to integrate, we need to be able to appreciate who has the strength to do what. We are talking about who, it's not only in terms of persons, it's in terms of which system has the strength to be able to take on new tools. When we are talking about integration, it's not just a matter of adding on. What we have learned from our previous attempt at integrating some of the malaria interventions is that integration really demands a bit of first disintegrating. You need to understand what each of the interventions has as a plus, which part of the intervention can be added, so that ultimately your goal of making sure that there is improved efficacy, there is improved effectiveness, you have a higher efficiency both on time, human resource, and finances are achieved. If you just add on, the likelihood of breaking the camel's back then happens. So one of the things that we did is to make sure that we start planning early. And planning involves not having people at the national level just talking and sitting together. What we did recently, where we integrated mass campaign of ITNs into SMC, was going to the regions, the district, talking to them, bringing up the ideas, taking their ideas as to which aspects of these interventions we can integrate and which aspects we have to leave them separate, and we have to leave them separate. Then they went back to their district to talk to their district directors. So these are people who actually implement the interventions. And there was a lot of back and forth for us to redesign what we had thought of as an effort as integrating two tools to save on resources. And it was done successfully. And thankfully, an intervention that could have taken like 12 days separately, we were able to do it in 8 days. It saved on the time of the health worker, it saved on the time of the parents, it saved a lot on resources, and we're able to increase SMC rounds from 4 to 5 and even get higher coverages with mass campaign. So I'll say that integration is important and possible, but it's not just adding interventions together. It's an effort that requires deliberate attempts, starting planning early, and really sitting down to see what will really benefit us if we add on, and what is it that we need to leave for them to stay separate. Thank you.